Hello everyone. Today, we're diving into the world of a medication called Ponatinib, commonly known by its brand name, Iclusig. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Ponatinib, often recognized by its brand name Iclusig, is an oral medication that falls under the category of tyrosine kinase inhibitors, TKIs. Its primary function is to inhibit the activity of certain proteins involved in the growth and spread of cancer cells. Iclusig was approved by the FDA in 2012 and is primarily prescribed for the treatment of chronic myeloid leukemia, CML, and Philadelphia chromosome-positive acute lymphoblastic leukemia, PH+all, in patients who are resistant or intolerant to other TKIs. Additionally, it is used to treat patients with the T315I mutation, a specific genetic alteration that makes CML and PH+all resistant to most other TKIs. Warnings: Ponatinib comes with its set of precautions. One of the most serious risks associated with Ponatinib is the potential for blood clots and blood vessel narrowing. This can lead to severe conditions such as heart attack, stroke, and loss of blood flow to the arms and legs. Therefore, it's crucial for patients with a history of heart disease, high blood pressure, or clotting disorders to inform their healthcare provider before starting this medication. Another significant risk is the potential for liver toxicity. Regular monitoring of liver function is recommended to detect any early signs of liver damage. Before starting Ponatinib, it is important to discuss your medical history with your doctor. This includes any history of pancreatic disorders, gastrointestinal issues, bleeding disorders, or any planned surgeries, as Ponatinib can increase the risk of complications in these areas. Pregnant or breastfeeding women should avoid using Ponatinib, as it can harm the unborn baby or nursing infant. Before taking this medicine. Before starting Ponatinib, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the cardiovascular system, those with heart disease or a history of blood clots should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood counts, liver function, and pancreatic enzymes is advised during treatment with Ponatinib. You should not take Ponatinib if you have an active infection or if you are experiencing significant bleeding. It's also important to inform your healthcare provider if you have any underlying liver or pancreatic conditions, as these can be exacerbated by the medication. Before starting the medication, inform your doctor if you have ever had high blood pressure, heart disease, a history of blood clots, bleeding problems, a history of pancreatitis, liver problems, or any gastrointestinal issues. It's also essential to let your healthcare provider know if you have any other health conditions that might affect your treatment. Side effects: all medications can have side effects, and Ponatinib is no exception. Some individuals might experience high blood pressure, which needs to be monitored regularly. There's also a potential for skin rash, fatigue, and abdominal pain. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of pancreatitis, a potentially serious condition characterized by inflammation of the pancreas. Symptoms can include severe abdominal pain, nausea, and vomiting. If you notice these symptoms, seek medical attention immediately. Another potential side effect is the onset of blood clots, which can present as chest pain, shortness of breath, or swelling in the legs. If you experience any of these symptoms, it's crucial to get medical help right away. Furthermore, Ponatinib may cause serious side effects including liver toxicity, bleeding, fluid retention, and gastrointestinal perforation. Regular monitoring and consultations with your healthcare provider can help manage these risks. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Ponatinib might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Certain medications, such as strong CYP3A inhibitors, can increase the levels of Ponatinib in your blood, potentially leading to more severe side effects. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Ponatinib. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Ponatinib for most adults is 45 mg once daily. However, your doctor may adjust the dose based on your response to the medication and the occurrence of any side effects. It's important to note that Ponatinib should be taken exactly as prescribed, without altering the dose or stopping the medication without consulting your healthcare provider. Avoid. While on Ponatinib, it's advisable to avoid activities that might increase your risk of bleeding or injury. Given the potential for dizziness and fatigue, it's wise to avoid driving or operating heavy machinery until you know how the medication affects you. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects and potentially increase the risk of liver damage. FAQ. Many wonder about the age restrictions for Ponatinib. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Ponatinib. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.